Dengue is a viral infection caused by Den 1, 2, 3, 4 viruses. Virus has an incubation period and a good amount of infections are asymptomatic and rest are symptomatic. Symptomatic cases they do present with fever, pains, muscles, bones and joints, headache. At times the is quite severe. Retroauricular pain may be quite severe. They can present with acute respiratory infection like features, acute watery diarrhea, and the rashes that blanch on pressure is found in 25% of cases. If you do the tourniquet test, that may be positive. Tourniquet test means raising BP between the systolic and diastolic and gradually deflating the cuff and seeing the your amount of purpura in the extremity, usually in the upper extremity. These cases may have hypotension. They may have CNS symptoms. This is symptomatic dengue. Dengue can be a little bit aggressive, like hemorrhagic dengue, bleeding from different sides. Dengue can be presenting with the shock, dengue shock syndrome (DSS), and ultimately in severe sort of worst kind of dengue, you can have end organ dysfunction, multiple organ dysfunction. So it is confused with other viral infections. Appears to be of a viral infection, and the chikungunya is a viral infection where you have more amount of arthritis, arthalgia, and the rashes. They are confused with the your ITP and aplastic anemia, grave sort of blood disorder. So they are to be investigated by CBC, plus minus peripheral blood film, and in the day 5 up to day 5 the NS1, the antigen, and afterwards the IgM for dengue. But there is good deal of overlap between the NS1 positivity and IgM positivity. So at times you need to do both along with the your CBC PBF. In bleeding disorder, in bleeding state, dengue, you should have the platelet count, platelet PT, APTT, and your other coagulation profiles. Confirmation RT-PCR, you don't need to do it. Most of the time, dengue is viral fever. Most of the time, it is symptomatic and supportive treatment. But when there is hypotension, you need to give sodium chloride, normal saline, at 5 to 5 ml per kg per hour, and if the patient improves, reduce the dose 3 ml, 1 ml. If patient deteriorates, go up 7 ml, 9 ml. In severe shock, you go up to 10 ml per kg per hour. Then assess at the end of the every hour. Secondary infections, comorbidities, they are to be treated, and your there's no rule of platelet infusion. The blood anemia needs blood transfusion, and your multi-organ dysfunction need to be addressed.